am Joseph Jansen of BS Nursing 1D and I will be your nursing student for today. Today, I will be performing the neurological assessment. Start off by identifying the major areas involved in a complete neurological examination. There are 5 major areas, namely the mental assessment, the cranial nerve, the cerebral assessment, the sensory assessment, and the reflex assessment. Today, I will be only performing the cranial nerve assessment 1 to 12. First, I will explain how we are going to prepare our patient for neurological examination. First, we must perform hand hygiene. Then, we will give our patient some privacy and explain what we are going to do or what are the process that we are going to do. First, we are going to test the olfactory cranial nerve 1, the sense of smell. First, ask the patient to clear out her nose to remove enemy booster. So, ma'am, can you please remove your nose? After that, ask the patient to close her eyes, include one of her nostril, and identify the sense of smell that I'm going to let her smell. So, ma'am, we are going to test your sense of smell and I want you to close your eyes and I'm going to cover one of your nostril and please identify this sense of smell. Close your eyes, please.
Perfume.
So, remain close, please.
Six.
So, now that's done. You can open your eyes now, ma'am. Now that we're done, we are going to proceed to cranial nerve 2. So, to test cranial nerve 2, we are going to have 2 tests. Number 1, we are going to be looking at the compensation visual field and we are going to be looking at the focal vision. Next, we will be looking at the visual acute and use a silent chart to assess that. First, we're going to test her profile vision, and to do that, we must make our patient stand up in front of you and about arm's length away. So, ma'am, please cover your right eye. I'm going to cover my left eye, and please identify how many fingers you see.
2. 1.
On the other side.
3. 4.
Very good. Now we are going to test the visual acute using the silent chart. So we ask the patient to stand 20 feet away from the chart and we must ask the patient if he or she wearing glasses or contact lenses. So, ma'am, are you wearing glasses or contact lenses?
No.
So the patient said that she didn't wear glasses or any contact lenses. So, ma'am, we are going to proceed to the chart, but first I want to tell you that we are going to proceed from the right eye, then the left eye, and we're going to do both. So let's proceed from the chart. So please cover your right eye and tell me what line are you going to read.
7.
Proceed.
FELOPZD.
So please cover your left eye and what line, please?
7.
Proceed.
FELOPZD.
Now we're going to proceed to the both eye. What line, please?
7.
Proceed.
FELOPZD.
So now that it's done and you do the procedure properly, and now we're going to proceed to cranial nerve 3. Next what we're gonna be doing is we're going to assess cranial nerve 3, which is ocular motor, 4 trochlear, and 6 abducens, which we're going to do several tests to check their function. The first one that we are going to do is we will be looking for any involuntary shaking of the eye called nystagmus. And how we are going to do that is we're going to take our ball pen and we will be gonna hold it in about 12 to 14 inches away from the patient's nose. So, first I would like to inform you that look at the pen with only your eyesight and don't move your head. So, let's start. So, now that we're done, we're going to proceed to the next procedure. Next, we'll be going to be doing to see how reactive the pupil to our light. And to do that, we're going to make our patient stare to a distinct object that help dilate those pupils. And we're gonna shine using our pen light or cell phone flashlight. Next, what we are going to do is to check for the accommodation, and to do that, we're going to make our patient look at a distant object that help dilate the pupils. And we are going to take our pen light or ball pen so that we are going to slowly move it inward to the nose, and we will see that the pupils constrict by accommodate and the eyes cross while looking at the ball pen or pen light. Ma'am, I would like you to inform you that just look at the pen and don't move your head. Just look straight to the pen. So let's start. So now that's done, we're going to proceed to the next process. Now, we can document that the pupils are equal, round, reactive to light, and accommodate so that where the acronym PERRLA comes into place. Now, we're going ahead and test cranial nerve 5, which is the trigonometrical nerve, and this nerve is responsible for many things like massification. And testing cranial nerve 5, I would like to request our patient to please clench her teeth. So, after that, we can touch the massification muscle and the temporal muscle. And to truly test the nerve, I would like to open your mouth against resistance. So that she can do that, that means that nerve is attached. Now we're going to look at the facial expression and test cranial nerve 7, which is the facial nerve. So in testing cranial nerve 7, I would like to ask our patient to do a frown, smile, and pop out your cheek, please. Now that the patient do that in the same way, we can say that the nerve is intact. Next, we were going to check cranial nerve 8, which is the vestibular nerve. What I'll do is I will enclose one of our ear and whisper 2 words on the other side and the other side. And our patient must tell what I'm going to say. So, let's start.
Baboy pusa.
On the other side.
Palakabaka.
So, now that our patient said what I've said, then we can say that the nerve is intact. We're going to assess cranial nerve 9, the glossopharyngeal. So, I'm gonna say and for the uvula to move up, and going to poke a little bit back, and there will be a illicit gag reflex. So, cranial nerve 10 is the vagus nerve. Is intact because she is able to talk to me without forceness, and she is able to swallow. Now we are going to test the cranial nerve 11, which is the accessory nerve. First, in examining the cranial nerve 10, I would like to ask my patient to move your neck up and down, side to side, and I would like you to shrug against my resistance. So, we can say that the cranial nerve 11 is intact. Next, we're going to assess cranial nerve 12, which is the hypoglossal nerve. So, in testing cranial nerve 12, I would like to request our patient to please stick out your tongue and move it side to side. So, she do that in a proper way, and we can say that the cranial nerve 12 is intact. So, that ends our cranial nerve examination. Of course, doing all the tests, we should summarize the information to the patient, perform aftercare equipment, perform hand hygiene, and document the finding of this procedure.